Hi, welcome to the virtual classroom. I'm Sheila Reyes, rheumatologist from the Philippines, and I'm excited to be moderating for this Room Now panel discussion. The COVID-19 pandemic has changed people's lives in more ways than one. And when it comes to medical education and professional development, rheumatology is no exception, as learning has become almost entirely virtual. Today, we'll be talking about the challenges and opportunities of online learning and teaching, as I am joined by esteemed clinician educators and researchers, Dr. Karina Torralba, Chief and Fellowship Program Director, the Loma Linda University School of Medicine, Loma Linda, California, Dr. Anisha Dua, Associate Professor, Director of the Fellowship Program and the Vasculitis Center at Northwestern University Feinberg School of Medicine in Chicago, and my fellow room faculty, Dr. Jeffrey Sparks, Assistant Professor of Medicine at Brigham and Women's Hospital and Harvard Medical School in Boston. So let me start off by asking Karina, how did the sudden shift to online learning impact your fellowship training program?
So compared to before, currently we're holding all of our conferences, about 100% are online now through Zoom or other formats. Um, we were kind of fortunate because before this all happened, about 20% of our conferences were actually already being done via Zoom. So when COVID hit, it was like, okay, we're shifting to everything being on Zoom. I think that was the main challenge. And the other challenges that we were facing more recently was that it's harder to teach the fellows the physical exam or how to do joint injections and that sort of thing. Things that are hands-on are harder definitely to teach in a virtual classroom.
Yeah. That's a good point. You mentioned there. It's lucky for you that you were at least in that state where you've a little idea of what to expect with using Zoom and all these things. I was wondering because you're also engaged in musculoskeletal ultrasound, right? So, how did that go? I mean, were there was were these classes continued or these sessions continued? And how about now? Are you still doing it?
Yes. So for the ultrasound session, so I'm also part of US Sonar. That's my other position, so to speak, out there. I'm part of the US Sonar faculty. So whether we teach ultrasound in the setting of our fellowship program or within the US Sonar setting, we still do the region-based lectures, how to do ultrasounds and that sort of thing through virtual Zoom formats. There is a mechanism which we are trying to fix right now within US Sonar, where we actually use virtual learning using a certain companies technology to teach ultrasound. And there's a way to do it where you can actually give instant feedback while they're doing the ultrasound. You can actually have a live session with them and the faculty is also there. So we're trying to work out the kinks on that, but there's a way to also do that.
Okay, that's very interesting. So, um, Dr. Anisha, uh, tell us tell us something about the virtual rheumatology learning or the viral collaborative. I remember attending those webinars. I even asked you, I think, if we could join here with my fellows from the Philippines. So, what do you think has been the greatest challenge in setting up these virtual collaborations?
It was amazing. I mean, honestly, it went really smoothly. I'm sure there were challenges, but it really came together quite well. Really, I talked to my fellow, and we didn't have any programs like that were virtual before. We were doing all of our didactics in person, whether it's small group sessions or large lectures or whatever it is. So when COVID hit and we weren't allowed to be together, essentially, or we were being deployed all over the place, there was no real plan for how we were going to teach or continue teaching. So I talked to my fellow who was mentioning some sort of program where like her husband could log in and hear some different talk from folks around from different universities. And then I just honestly sent an email to like a handful of program directors saying like, let's pool resources and figure out a way to continue to teach, and it just picked up a ton of momentum. People were excited, and it came together amazingly. Obviously, I mean, I don't know, I don't even know how many people registered. There was like 2,000 people registered. I don't know, 50 countries. I mean, people were logging in from all different time zones, which you know. And then the nice part was that the things were recorded, right? So people could log in, you know, if they had other obligations or it was in the middle of the night, they could still access that information. It was a nice way to keep the community kind of engaged and connected. I think the only hard part was kind of, we didn't have a curriculum, right? Because everyone's in different phases of their curriculum teaching at that point in the year. So it was a little bit less structured in terms of what topics we're going to cover, whether or not we'd be able to cover the breadth of topics. And we were kind of, you know, using volunteer speakers and saying, talk about something you like to talk about, which is different than most curriculums that you try to sort of deliver in a structured format. But otherwise, you know, the ACR helped out a ton. They did all of the tech support. They did a lot of the advertising and stuff like that. And it just kind of went from there. And now it's sort of gone on to a couple other phases, which is cool because, I mean, it's not cool because it means we're still in the pandemic and we're still having to do this, but they've been able to sort of leverage that, whatever momentum came from that, into a couple of other programs that we're now working on. So that's kind of how it came together.
Yeah, that's really great. I mean, it's a collaboration of sorts, you know, not just within within the area, but also international. Um, Jeffrey, so you're both active in clinical research and social media. So, how are you able to utilize this to your advantage in terms of online learning or teaching?
Mm-hmm. Well, first, I want to thank Anisha for the viral collective. And I actually participated. I don't know if that means I've been demoted to fellow, but I learned a lot. So thank you for that.
Yeah.
And Karina, you are definitely ahead of the curve because I cycled through every single video software. There were days where I used Skype and FaceTime and Doximity and Zoom before actually learning Zoom was the best. So that's impressive. You know, my personal tidbit related to education and the pandemic was that as one of the hats I wear, I helped to direct some mentorship programs for research. And one of those programs is called Verity. And we actually have, every other year, we have a conference that I direct. And this is sort of a boot camp for epidemiology and for grant writing. And we have people apply. There's, you know, competitive process, and it's, you know, 100 different sort of breakout sessions and didactics, and everything was all set. And then obviously the pandemic happened. And I think it's just got to be one of these things where obviously it was really terrible when it happened because we had to make this bad decision about, do we just cancel or do we try to reformat on the whim? But I think we have to sort of take it as a challenge and an opportunity. And the opportunity that I saw was that we could somehow have both the virtual component as well as sort of the deeper component for people who were bringing projects and grants that we're helping to edit. But, you know, really on a whim, we decided to, you know, have everyone participate in the didactic lectures. And, you know, we definitely advertised online, not knowing what we would get because there were, I think, 15 people who were going to come here to Brigham for a week. And it was incredible. We had over 100 people sign up, 5 continents, spanning all these time zones. And then we also were able to, you know, log these videos for people to see at their own leisure. And I think looking back, it would have been the easy decision just to say, you know, not do it. But I am really thankful that we went through and I learned a lot. And I felt like it really brought our community together. And I've never been more thankful to be a rheumatologist, just seeing how everything came together and how we responded to the pandemic.
Yeah, that's a pretty good job you made there, and congratulations on your lecture. It was really fantastic. Um, so with all this thing going online, how do you give feedback to your learners? I mean, do you think there are still gaps in those things where there's there's asynchronous learning, there's blended learning? So I'm curious about how you're able to give feedback, and how does your students or trainees feel about this? So Karina?
So I think, you know, giving feedback at the time when you were still seeing patients' lives is definitely different from having a fellow learner, for example, call the patient first or see them on video first, and then trying to incorporate the attending after talking to the attending into that session where you're talking to the patient and giving feedback also live at that point. It, I think for us in Loma Linda, we kind of ended up deciding that we really have to proactively give the feedback there and then, knowing that there are a lot of limitations when it comes to seeing patients who are not in clinic, for example. We have to be very careful about trying to evaluate whether patients really have active disease or not. And then we make judgments whether we need to efficiently use the time of the patient to come in, risk getting COVID and all that. I mean, you're risking getting COVID from anyone, whether from the patient or patient getting from you, whoever. So I think we were making decisions at that point where if we were not satisfied having to see a patient through phone or video, we would have to make decisions whether to have them come in to do an additional ultrasound, to evaluate the RA disease activity, or to do an injection and so on and so forth. I think it came to the point of efficiency where we had to decide what was best for the patient ourselves in terms of safety, efficiency, and also being able to evaluate disease activity if in a more, I would say, not only efficient manner, safe manner, but also in a way that's a little bit more sensitive to what the patient needs. Because a lot of the patients, to be honest, were not very comfortable coming in, even after we've seen them maybe a couple times in video. We're still trying to figure out exactly what's going on with them. Eventually, I think the patients became more attuned to the fact that us giving feedback to them was also a problem because we couldn't fully assess them. So for us in rheumatology, for us to give trainees feedback, it's really harder to assess what's going on with the patient and really trying to assess if what the fellows actually did was correct or wrong. So I think that's one of the challenges that comes with this.
Yeah, yeah, I do agree with what you've said. Even here in our practice with my fellows, it's really hard, especially since our field is really into the actual examining of your patients. It's really hard. There are still barriers, despite all the available methods that could be used. How about your experience, Anisha? Could
Yeah,
you share
I was gonna add, yeah, of course. I think at the beginning it was feedback wasn't prioritized because it was just trying to get by. So there was a lot of adjustments just in terms of how do we adapt to this? Are we doing, what platform are we using? Are we using phones, videos? How are we going to take care of our patients and take care of ourselves? So I think that did probably slip a little bit at the beginning until we tried to until we realized this is going to last for a while and we need to really reincorporate that. For me, one of the biggest worries was when the new fellows were going to be onboarded. To try to train them in rheumatology virtually was something I didn't think was fair to them, in terms of just how they need to learn how to touch and talk to a patient. So that was my priority when we were going, in terms of getting back into the clinic, and that the fellows were the first people that needed that space, the first year fellows, because they're the people that really need to have that hands-on sort of training at the beginning and feedback. So I think an important thing is just remembering that you have to still do it, right? So in person, it's easy to sort of walk out of the room and just sort of regroup and say, hey, here's some things you could have done differently. And then it's just more of a natural flow to giving feedback. But with this, I think one of the main things was building in time into our actual workflow to say, we're going to go through these number of patients. I might not split up in between each patient and tell you some, new facts or give you some new ideas or talk to you about how you did, but setting time aside either before or after your clinic, however that clinic is, to give feedback and just making sure you prioritize it. I think that was what I did with my second years. It was easier when it was like the second half of the academic year, because at least I felt comfortable in my fellows' abilities to get histories and triage. But it was more of a challenge, I think, at the beginning of this academic year with the onboarding. So with that, I think I had to really stress the importance of the fellows coming back into clinic.
Yeah, I do appreciate how all these that you've been doing despite all the potential barriers, all the potential problems, has come out to be something more positive. So, Jeff, you're into mentoring, right? Have you developed or have you come across or used any innovative measures or innovative ideas in teaching or in learning?
Well, I think I'm learning just as much as everyone else. And I feel like there's been an evolution, just thinking back about how in April, when you really didn't want to watch the news or you couldn't really leave the house, like really, for instance, didactic conferences had never been better attended. And people really just wanted that human connection. And then there was some point, Zoom fatigue was a real thing, it set in. And, you know, the conferences were just had a different sort of flavor, and people were a bit sick of, you know, Zoom and seeing each other in this format. And I think it's been sort of a pendulum that's been swinging as far as like how to best integrate this sort of video format. So for me, you know, I think obviously when you're talking about clinical care and having to actually physically interact with patients, that's one thing. But in a lot of the things that I do, you know, it's really, you know, there's really no reason to be in the same room. We're really not allowed to have meetings. So I think, again, it's like a challenge and opportunity. So I know that I've saved a lot of paper over the last few months, for instance, and actually the share screen has really worked well as far as, you know, editing papers, PowerPoints, actually looking at the same thing, you know, with programmers looking at code together. So I think actually there's been some things that have actually made things easier just because there's not this sort of delay over email, or I don't know what they're looking at, and you know, I'm trying to verbalize what I'm thinking and they're not understanding. But certainly I think there's been certainly too many Zoom meetings, and we're trying to kind of get that sweet spot where we get everything accomplished, we get enough human touch. I've also learned that if you wanted some informal discussion, it's not going to happen if there's more than 10 people on a meeting. People are just going to, you know, make Brady Bunch jokes. So, you know, I think we're learning as it comes, and, you know, probably Anisha will really teach me how to optimize things. She's the real innovator, as well as Karina.
That's very kind. No.
Yeah. How about you, Anisha? Were there any, well, did you develop or were you able to develop or utilize any innovative
I mean, you know, honestly, I think I agree with what Jeff said. You know, there was excitement at the beginning because everyone was so isolated and you wanted to just connect in any way possible. So I think at the beginning, it wasn't too hard to just give basic talks, right? And people could see each other's faces and you could learn some information, and that was enough. As we've moved farther and farther into the pandemic, I think it has been more important to try to make things more interactive. And whether that be through like doing small breakout groups, discussions, or like having my fellows attend like something that's more national and then coming back to me. And when we're in clinic, kind of regrouping and discussing that in a more case-based format, to just have actual discussion about things is really important and key. Whether you do, you know, incorporate more polling questions or try to do like breakouts where people are having discussions about cases and then come back and report back. You know, we've really had to go back into like these educational theories that we sometimes apply to our way of teaching, but not always. And we've had to go back and I think really think about which ones we can use and amplify to try to really get people involved, because everyone has different learning styles. You know, some people just can't stare at a picture or a screen all day. So I think it's just important to just switch it up and try to figure out, you know, how we can keep this exciting and interesting. I don't think it's easy, and there's definitely no expert I know of on it. So.
And I'll mention that work and home is really intersecting more so than ever. And I think, again, you got to take it as a challenge and opportunity as far as when your learners are having these difficulties to overcome, and to be really empathetic about all the challenges that they're going through, and to be, you know, very understanding about the really tough situations that people are in. And I feel that's a way that we can sort of bond as, you know, humans and peers and mentors as well. And again, try to troubleshoot and try to solve more problems than we create.
Great. I think that's one of the things that's been tough just with like the homework balance stuff, because there's not that physical separation as much anymore. And so there's a lot more blended you know, you're kind of expected to do patient care or, you know, research stuff. Well, you're always expected to do, you know, your research stuff at home, but like part of the time at home or in evenings or odd hours, but there's more of that. And so there's a little less protection of your personal time. And I think that goes across the board for fellows, you know, junior faculty, chairs, whoever it is. You know, you're kind of expected to always be at your computer because we are at our computer so much more now. So I think just like making sure we keep our finger like or our head, something on the pulse of like how people are feeling and doing it if they're feeling like okay and still happy and like a whole person. I think that's a really important piece that as we move forward, we need to like just keep looping back on.
Yeah. I do agree. Karina, I think you were raising your hand.
So it's kind of interesting
We're
because
like in a classroom.
so it was kind of interesting because Anisha mentioned the learning style. So you have visual, auditory, depending on what kind, but that's the one I'm thinking about. Tactile learning, you know, I was mentioning the loss of opportunities to do procedures and ultrasounds. So it's kind of funny because in my division, we had like, I don't have like a stockpile of $1 million, but it kind of forced me to actually spend the money and buy thousands of dollars worth of simulation equipment. So I actually, you know, bought various joints and I actually gave one to a fellow, to each fellow, and then required them to wipe it down after each time and then rotate the equipment. So I kind of expected them explicitly. Again, this is where the explicitness comes out in this setting where it's all virtual. You have to get rid of all the implicit expectations. You have to be very explicit with it, with the expectations of the fellows moving forwards. That, you know, you're expected to learn these injections with the foot, for example, and be able to learn it within the 2 weeks you have this simulator, and then move on, give it to the next fellow. So we kind of ended up adapting that for our division. We also got like simulation equipment for ultrasound guided injections. That kind of equipment is actually already available. So our division also invested in that kind of thing. So that was one. And the second part that I think is, you know, we keep on talking about medical knowledge, but our interaction actually with ICU intensivists and other specialties like ID, hospital medicine actually improved since COVID, because unfortunately we got tasked to take care of cytokine storm patients. ID didn't want to take care of it. We got tasked to do it at 2 of our hospitals. So it was a lot of workload for the fellows, and eventually we did set up a non-teaching service for the one attending who took care of a majority of the patients. But the fellows got to learn a little bit more in detail how to take care of these patients in a more intensive way than what they're usually exposed to in a regular rheumatology fellowship training program had it not been for COVID. So I think I just want to highlight for the fellows because they did a lot of work since March, just taking care of the patients.
Yeah, you're right about that. And I think it's very important, you know, that having a support group where you get to at least look into what's happening, or you know, giving tips, giving stuff, you know, that could help one another, especially since we've lost that element of connection in terms of being able to see face to face or meeting face to face. So okay, so coming into ACR, now that it's the meeting is almost over, so I just wanted to get your thoughts about how the ACR virtual platform, how you've been able to utilize or appreciate, or you know, use what you have, and coming into this conference. I mean, uh, what would you say about it, Jeff? Let's start with you.
Well, I mean, it's without a doubt exceeded my expectations. And honestly, I've seen way more science this meeting than any other meeting in the past. And it, you know, that has been at the detriment of networking, but there's actually been more networking than I anticipated. I think the website worked really well. I love that the videos of the talks were really posted almost in real time after they were complete. The community hubs were a big success. I think the ACR ambassador program was a big success, and obviously there's a big social media presence. And I think compared to last meetings where I would say I would come back and watch videos, and when they actually appeared a couple months later, I kind of forgot which ones I was interested in. It's kind of really nice to like, know that, tomorrow I can still be watching videos, and I think I will. So I think it's been a big success.
Yeah, I think we really need to give credit to the organizing committee for having thought this whole process through in terms of how the delegates or participants will really maximize the experience. Anisha, how about you? Uh, yeah.
I think, well, I mean, Jeff is sort of ahead of the curve with Twitter. And so I think I've been on it just more recently, but it's amazing how much you can learn there and how much time you can spend on it. But in terms of like incorporating fellows and just people all over the world, and like just with the the global COVID project, I mean, the GRA, there's just been such fantastic international and like multi-level disciplinary collaboration that's sort of found a lot of its roots, at least as far as I've seen, on Twitter, which is amazing. So it's been cool to be able to see that and sort of tag into pieces of it. And I think ACR leveraged that well. And we're able to get some of their, sessions out and some of the main points out. I love in-person meetings, so this does not replace it at all for me. But I have to say, along with what Jeff said, I have not attended as many sessions as I had this meeting in the last many years, because you're basically on your way to a meeting a lot of the time, or with people, or in other meetings that are not actually the scientific meetings that I would normally want to attend. So content-wise, I actually think I saw more. I think they cut down the schedule a lot and made it more manageable, so that you could sort of sort through what was happening at any given time and really pick and choose a little bit better. I think it would have been nice if there was still an app, because I still was sort of navigating around on different ways to figure out what I wanted to see. But I think they did a phenomenal job, honestly. The platform worked well. There was a couple, little glitches here and there, but nothing really too problematic, Yeah, I really thought it went well. They covered a lot. I still hope that, we do move back to in-person meetings, or at least mostly in-person meetings. But I think given the circumstances, it really came together really nicely.
Yeah, yes, I do agree with you in that, nothing beats the actual face-to-face meetings where you have to run through different rooms or halls and, catch up on what lectures you want. So Karina, you've also you were also able to lecture for the meeting. So how did that pan out? I mean, with your perspective being the lecturer and also being an attendee, what could you say about it?
So I'm a lot older than the two other people in the group right now. So and I'm less tech savvy. So I think it was actually a good experience. Again, I was lucky because we were already using Zoom in my program. So the speakers were asked to, record their talks on Zoom, I think 1 or 6 weeks before. There were some technical glitches, but eventually ACR, the staff actually fixed that and stuff like that. But I think it actually went well in terms of, from the standpoint of being a speaker. I think it's actually better to have the recordings done rather than rushing to a room and then giving your lecture and then sweating it out because you're so anxious about how people are going to react. I think giving the time, the 15-minute slot, because I gave my lecture with Jim Katz. In the end, we had 15 minutes to kind of discuss questions and that sort of thing. I think having the recordings done kind of controlled the part about where people kind of overrun into time and stuff like that. I think that was a little bit more manageable than, let's say, if this was done live. And less surprises, so to speak. But yeah, I think for me, like Anisha, there's no replacement for a live meeting. And I think in my situation, I'm a little bit being chief, to be honest, 95% of my time at ACR is actually spent schmoozing. So there isn't a lot of schmoozing I can do during this ACR because I think some of the companies couldn't do the schmoozing with the platform ACR was using. But there were ways around it and I had to be very creative of how to go about that. But yeah, this is probably like the first time in many years I've actually sat down and listened to lectures for 5 hours straight. Because again, a lot of times I'm actually talking to people. Yeah.
I'm less
Yes,
fit
I
at the
think
end of this meeting than other meetings because those steps in the conference halls are are something
yeah, yeah, right.
on spot for a while.
Yes. Uh-huh.
Notice
So
the
I
posture.
think we're in agreement in terms of, um our experience with the ACR. So there's really no magic formula in doing these things, but you all rose to the challenge of leveraging new ways of learning, both for your colleagues and your students. So this has been a very engaging discussion, and I would like to thank everyone, Karina, Anisha, and Jeffrey, for sharing your insights and giving me this opportunity to let others know what you've been doing and been doing well so far. So once again, I'm Dr. Sheila Reyes. Tune into Room now for more videos and reports. Thank you.
Thanks.
Bye.